Hello, my name is Allison Warner, and I'm the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about what you need to know as you welcome back patients. We want to help you minimize the exposure to COVID-19 and establish best practices in your office going forward. Today, we're going to talk about how do you know that all the steps you are taking to sterilize and disinfect are effective, especially since you are spending a lot of time and a lot of money to make sure you're doing what's best for your coworkers and your patients. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you again.
Wonderful to see you again, Allison. I'm getting such great feedback from our In the Sterilization Room episodes.
Yeah.
I just received an email last night that one of the orthodontic assistants said, "Oh, I'm getting all sorts of good information in each of the episodes." So we're sharing some good resources, some help update the teams as they navigate through all of these changes with it.
Yeah, definitely. I think that's what we really want to do. We want to be here for them. So
Yeah,
I know you want to talk about validation today. So
yes.
practices are taking all these steps to clean and sterilize and disinfect, but is there any requirement for testing and record keeping?
There is, Allison, and we've talked about the techniques even last week when we looked at the IFUs or MIFUs for handpiece sterilization, and we went to the CDC guidance on it. CDC recommends, and again, part of their guidance is that we keep logs and records on the testing and the validation that we do on each step of the instrument sterilization with it. And I'd like to start with the first step,
Mhm.
cleaning the instruments.
Okay.
When they
So,
come into the sterilization room, you know, they're dirty and we
yeah.
have to have some method of cleaning them, and that's frequently an ultrasonic cleaner.
Okay. So how do you know if your ultrasonic cleaner is really working?
Well, that's a good question. Often the offices may have bought an ultrasonic 15 years ago and they turn it on and it makes noise. It goes zzz, and I've heard it referred to as the jiggleator, that it's jiggling the instruments.
Uh-huh.
Really, ultrasonics clean by sonication, or to make it simple, it creates bubbles and the bubbles implode. And as the bubbles implode, it pulls the debris off of the surface of the instruments, especially in the small nooks and crannies, say in a plier where it opens and closes at the hinges, and
Mhm.
in the knurling on the handle that makes it easy for you to grip. Ultrasonics get instruments 17 times cleaner than you could ever get them hand scrubbing.
Mm.
But we need to know, is it really creating the bubbles and imploding the bubbles, or is it just making noise? And the
Mm.
way to do that is a very simple aluminum foil test.
Ah, okay.
Yeah, the offices can take regular weight aluminum foil, just like you have in the kitchen,
Okay.
and they're going to tear off a strip that they can hold into their ultrasonic that they can leave, and it won't touch the bottom or the sides. They just want to
Okay.
suspend it in there and hold it for about 20 to 30 seconds with the ultrasonic on.
Mm.
And then when they lift it out, they're going to look at that aluminum foil. If it comes out shiny, their ultrasonic's making noise, but it isn't cleaning.
Mm.
If it comes out with uniform dimples or pimples on it, or hopefully even holes in there, then it's working. It's cleaning all of those instruments.
Okay.
So that's the validation test. And, you know, I would recommend to the offices that they create a log sheet like
Mhm.
this that they
Mhm.
can check off. Hey, we did the aluminum foil test,
Mhm.
and yes, it is working and it passed on there. And unfortunately, many years ago, almost 40 years ago, there
Mhm.
was an ultrasonic cleaning solution that was created that was supposed to be a no rinse
Mhm.
ultrasonic cleaning. Well, CDC requires that instruments, after they've been ultrasonically cleaned, that they are rinsed thoroughly to remove any debris that might be in the solution, in the ultrasonic solution, and any chemicals that are on it. So instruments need to be rinsed
Mhm.
after they've been cleaned. And then they're going to be dried,
Mhm.
packaged, and sterilized with it. Now,
Okay.
ultrasonic cleaning solution gets a lot of debris in it. So it definitely needs to be changed every day.
Mm, okay.
And that's what you can also keep on this log sheet, you know, that the ultrasonic was drained and it was cleaned every day. Oh, and I should mention with that aluminum foil test, they
Mhm.
need to do that test at the end of the day, right before they're ready to drain that ultrasonic,
Mm.
because there could be some floating aluminum foil particles in the ultrasonic solution, and that aluminum could combine with the stainless steel or the carbon content and be detrimental to the pliers or
Uh,
to the other surgical instruments in there. So you want to drain all that aluminum out, rinse the tank, wipe it down, and then it'll be ready to refill the next morning. And another caution for the team when they're filling the ultrasonic every morning is, first of all, you fill the tank to the fill line with water and then add the ultrasonic cleaning solution and check your measurements. Sometimes teams will change brands.
okay.
They're looking for a different brand ultrasonic cleaner solution that is maybe less expensive,
Mhm.
or that has other added benefits such as an anti-corrosive and lubricant chemical added to it. And when they change, they keep putting the same amount that they did for the previous product they were using,
Oh.
rather than looking at, now, a lot of the large tanks that ultrasonics use, that ortho offices use, are about 2.5 gallons. So they're
Mhm.
going to need to know how many ounces of that ultrasonic cleaner or how many tablets do they add to the size tank that they have. So measuring the correct amount of ultrasonic cleaner, changing it every day, rinsing instruments afterwards, and I would say do the aluminum foil test at least once a month.
Mm.
However, for most of my clients, I recommend do it once a week when they do the spore test on the autoclave.
Ah, okay.
So that keeps everything going, you know, hey, this is the day we do the spore test and we'll do the aluminum foil test at the end of the day, and making certain that that piece of equipment, that cleaning equipment, is working effectively. Now, many offices are moving to the instrument washers and getting away from, I call it the dip and drip method of the ultrasonic. And
Right.
with instrument washers, there is also an instrument washer test, and you just attach that to the rack on the inside, run it through with a regular cycle, and when you remove it, you see that all of the chemical, the dye, has been removed from that test with it. So that's a good thing to do once a month on the instrument washers also. And then keeping the log sheet of that,
Yeah.
that goes in. You don't have to keep the written paper. You could scan it once that's full.
Mhm.
And keep it as a digital file. But because very often in the sterilization room, they don't have a computer monitor or keyboard that they could enter information into. So I recommend that they print out the paper one and tape it on the inside of the cabinet door above that piece of equipment.
Ah,
That way it's easy for the sterilization tech, the assistant, to go ahead and check off and initial each step of the process. And then when it's full, then we can create a digital file for it. But
mm,
it saves them, because often if they have to go to a computer out in the clinical area or up in the administrative area, they might forget. So
right.
keeping it right there above that piece of equipment is good. So that's how you would validate the cleaning process and bring us up to speed on the current recommendations.
Okay. So once they have the instruments cleaned and packaged, then what kind of records do they need to keep on their sterilizer?
Well, I think everybody's familiar that they need to do a spore test at
Mhm.
least once a week here in the United States. Now, in Canada, they do a spore test every day
Ah,
on their sterilizers there. So when you get into international regulations, it can vary
mhm.
from the U.S. standards with it. But they need to do a spore test at least once a week on every sterilizer in their office. Now, that spore test can be one that they mail off to
Okay.
a testing facility, or they could buy an incubator and purchase little test tubes that they can use that have the spores in them and incubate in their own office. And then again, that's where they would keep a log sheet
Hmm.
of the sterilization cycles and when they've done the spore test. Now, if they're using a third party, if they're mailing off those spore tests, obviously they'll get records back from the testing
Right.
facility.
Hmm.
Although I will say recently, I've had a lot of the offices that comment to me, the laboratory is slow to get us back that information. Sometimes
Okay.
it takes a week or two or three. So it might be something that you look at both as getting immediate results
Hmm.
and saving money to start get an incubator and do in-office spore tests. But that's a learning curve and it's recommendations. Now, The other part that CDC, when they updated their guidelines for infection prevention and sterilization in 2016, they included that you should keep a record that the sterilizer ran a full cycle each
Mhm.
time. So
Okay.
sometimes especially with autoclaves, if we don't add water when it's low on water, you can push the start button and it'll give you an error message and
Mhm.
say, uh-oh, it aborted the cycle because it didn't have enough water to make the steam.
Mm.
Or maybe the gasket didn't seal, or there are a number of things that could interfere with that cycle. So on that log sheet, you can check off the time that, say, the first cycle was started at 8:30 in the morning,
Mhm.
the time that you open the sterilizer at maybe 9:30, 9:45,
Yeah.
and check off. And then you want to know that it completed a cycle, that it was successful, instruments were sterilized with it. And then as you remove the instruments from it, you want to look at that cassette or look at
Mhm.
that package, and did the indicator change color? You know those
Mm.
dots we've talked
Yeah.
about that
Mhm.
change color, the internal extra? Well, we want to know that the colors changed, because it is possible that if you had an error message and you didn't notice that you could open the door and go, oh, these instruments must be done, take them out and put them into sterile storage ready to use, yet they're not really sterilized.
Right.
So keeping a record of each sterilization cycle, and then did the colors change, and then doing the spore test, that's the record keeping that they need to do on the sterilizers. Now,
Mm.
there's a little bit more maintenance.
Okay.
The gravity type sterilizers, say, the ones that open the door and let the steam out, and then the residual heat dries the instruments,
Mhm.
they have to be cleaned about
Okay.
every 28 days is what the manufacturer's instructions. When I looked at the Midmark M11, it said yes to clean every 28 days. Now that
Okay.
cleaning process means that you drain the water from the tanks, you add in the cleaning solution, you run an empty cycle, no instruments in there,
Mhm.
then drain out the cleaning solution, then fill it with fresh water, run one more cycle to flush all the cleaning solution out, then drain that out, and then refill the sterilizer, and it's ready to go again. That
Mm.
does take time. It
Mhm.
takes about 2 to 3 hours
Oh, okay.
to run it, because you can run the short cycle. You don't have to run a full sterilization cycle, but that helps the sterilizer to last longer, perform better, and prevent failures with it, because these are expensive pieces of equipment. Now, the
Right.
newer technology that is coming out into the sterilization room, those sterilizers, like with the StatClave, it
Mhm.
uses fresh water for each cycle, or
Okay.
the Statum uses fresh water for each cycle. And so when you're using that fresh water rather than reusing it, the oils and debris doesn't build up inside
Mm.
the sterilizer or the tank, so they
Okay.
don't have to have that monthly cleaning maintenance
Oh,
with it.
okay.
So you save. And then too, when now the new sterilizers that are available,
Mhm.
technology is coming into the sterilization room, because there may be a USB or a
Mhm.
Wi-Fi connection for them, and it records all of that information, each log
Mm.
for each cycle automatically.
Okay.
So we don't have to keep that written record with it. So again, we're updating and bringing technology into the sterilization room. I'd love to see that. Now, the traditional sterilizers, some
Yeah.
of them have printers that you can attach to it, or
Okay.
some sort of record keeping device. So
Mhm.
you do need to keep a record of each cycle on it, and then maintain the sterilizer properly.
Mm.
So it again, those logistics, or excuse me, I should say, the validation, the record keeping on it. If you had an inspection, say there
Ah.
was some sort of breach in the office, or a patient said, "Oh, I acquired herpes in
Mhm.
this office. I never saw the sterile package for those instruments." Well, you could provide that documentation, the
Ah.
record keeping.
Okay.
Yes, here we maintain our sterilizer. Here's each of our spore tests. So it's that backup to give you the validation that yes, you're doing everything correctly.
That sounds even more important given everything that's going on. So.
Oh yes. Yeah.
Okay. I wanted to ask you about cold sterilization. I know in California it's not allowed anymore, but is it still in use? And if they are using it, what kind of record keeping should they be doing?
Yes, there cold sterilization chemical, the ingredient that is in it is a glutaraldehyde,
Mhm.
and that's an extremely toxic chemical,
Mhm.
both the
Okay.
fumes that can come up from the container that you soak things in. And
Mhm.
traditionally in ortho, we've used, it's referred to, it's really high level disinfection, but we've referred to it commonly as cold sterilization.
Mhm.
Because it's so toxic, OSHA has printed a book on safe use of glutaraldehyde in healthcare facilities. And
Okay.
they require it to be in an enclosed container with a lid on it, with a drain tray of some sort, that you don't have to even reach into the container of the solution with a gloved hand. And of course,
Mhm.
you'd want to be wearing utility gloves with it. And
Yeah.
then all items that are soaked in there have to be thoroughly rinsed. Well, traditionally, dental and orthodontic offices have put things that are heat sensitive, that could melt in
Mhm.
a hot sterilizer into the cold sterilization. And that might be the cheek retractors, the intraoral photo mirrors, things like that, that
Mhm.
again might melt. Well, you can set your sterilizer to have a plastic cycle.
Oh, okay.
So an autoclave that normally we set at like 270 to 275 degrees, you can set it at a cooler temperature of 250 degrees,
Mhm.
which allows you to sterilize plastic items.
Oh, okay.
So by doing that and having that plastic cycle with it,
Mhm.
we're able to even autoclave plastic items. So it gives us, that cycle takes a few minutes longer, not much, but a few minutes. And so we can use that steam, which is environmentally friendly,
Right.
versus a toxic chemical that in some states is no longer permitted use. Now, many states do still use it.
Okay.
So the concentration of glutaraldehyde is usually somewhere between 2.8 and maybe 3.3%. Well, you
Mhm.
can imagine, Allison, that as they're putting cheek retractors in there that they've just rinsed off
Mhm.
from the ultrasonic, they could be adding water to that. And
Mhm.
cold sterile, it's an expensive chemical. You pour an activator in it, and the label states that it's good for use and reuse for 28 days. Well, as they continue over 1 month period of time, adding all of those wet things, it adds
Mhm.
extra water and could dilute the chemical down to the point that it isn't
Oh,
achieving the high level disinfection. So they
okay.
need to test their cold sterilization solution. And there's a little paper strip that they
Mhm.
can just put in there, lay it out on a paper towel after they've wet it with a cold sterilization solution, and it will do a simple color change on it if there's still the correct amount of glutaraldehyde. So I
Mhm.
would recommend that they do that at least once a week over that 4 week period that they're reusing it, if not every day. And the test strips are specific for the brand of cold sterile they're using. So if they're using Sidex or
Mhm.
ProSide, then they would buy the test strips for that particular product, because again, the
Okay.
concentration levels would vary. So that's another record keeping that they can create, again, a simple log sheet like
Mhm.
this,
Mhm.
and have that on the inside of the cabinet door above the cold sterilization area, and indicate when you've emptied it, when you've refilled it, and
Mhm.
when you've tested it and was it a positive test. So
Yeah.
we've got the cold sterilization. So now we've tested the cleaning, we've
Mhm.
tested the sterilizer, we've tested if they're using cold sterilization, we've tested that.
Okay.
And so that gives us that validation that, hey, in the sterilization room, all of our equipment is working, and we're doing it the way that we should be doing it.
Okay. Well, are there any other tests or record practices should be doing? What about water lines, especially since practice has been shut down for a few months, chairs have
Yeah.
been out of use? What about that?
Yeah, well, that stagnant water
Mhm.
inside of the unit, once water comes into the building from the city water, it's safe to drink. You and
Mm.
I both know that we keep our hydration around, and it's safe, and we're not going to get any intestinal infections from
Mhm.
drinking water that comes from the city, because it's under 500 colony forming units per milliliter. That's the threshold for potable water with it. And
Mhm.
that should be the same for the water that comes out of the air water syringe, or if you have water going through your handpieces at the
Mhm.
dental unit. However, when that city water comes in and it goes through the distribution box, the tubing that's in there is so fine and the water stays still in there that it allows what is referred to as biofilm to build
Mm.
up inside that tubing.
Okay.
And it looks like a jelly mass that is loaded with bacteria.
Okay.
So offices in the last 10 years, we've gone to what is referred to as dental unit waterline maintenance, where you
Mhm.
shock your lines to remove that existing biofilm, and then
Mhm.
you treat them with a chemical that is either in a tablet or the straws to prevent future biofilm from building up. And then you need to test to see if what you're doing is working.
Mhm.
And you can do an in-office test. We've talked about using the QuickPass test, the little water filters that we
Oh,
have. Yeah, yeah. And you fill it with water and let it soak, then pour the excess water out, and then turn it upside down and incubate it in the office.
mhm.
And once you look at it, it gives you a grid on the instruction page to see, how many colonies are on here? Are you in the safe zone under
Mm.
500 CFU? And then another log sheet. And I like the QuickPass because they
Mhm.
can do that in their office and they can keep their record. Another documentation that, yes, we are treating our water lines and everything is safe for
Mhm.
patient care. So another validation, if you will, to keep those in either a digital file
Mhm.
folder on the desktop, then as our sterilization file, or they can keep the printed records. I'd recommend that keeping all of those records for at least 3 years
Ah,
before they discard them.
okay.
So yeah, yeah.
Um, I want to shift gears a little bit. We've talked a lot about disinfecting. Let's talk again about what should staff know and how do you know that you're using these products correctly or that you're doing the right.
Well, that's come up a lot, Allison. I've been doing Zoom training meetings
Mhm.
because the offices want to be certain that they know how to use this airborne disease PPE,
Yeah.
for the aerosol splatters. So, how do you do a seal check around an N95? But one of the questions that frequently comes up is during the Zoom training session, I will ask them, which disinfectant are you using? And we
Mhm.
actually check the EPA listing for SARS-CoV. Is it effective? And then
Mhm.
I'll ask them, what's your wet contact time?
Mm.
And very often they look at each other and go, do you know what is it? And I'll have maybe one or two guesses on it. So they do need to read the label
Mm.
on their disinfectant, turn it around. You want to read down to disinfection to what are the steps you need to do to kill all pathogens.
Mm.
It may give you a short time and an easy step for some easy to kill microorganisms,
Yeah.
but you want to kill all of the pathogenic microorganisms. So is your disinfectant a cleaner? How long does it need to stay wet on the surface to kill all of those pathogens? So if your disinfectant contains alcohol
Mhm.
as one of it may not be a cleaner because alcohol is not a cleaner with
Mm.
it. So and it may evaporate if the disinfectant says it needs to stay wet 3 times and it has alcohol in it. You can imagine that that would probably evaporate in 30 seconds.
Mm.
So it may require re-wetting or additional chemical to be added to it to have the kill time. I like the accelerated hydrogen peroxides because
Oh.
they are water-based, they stay wet longer,
Mhm.
and they're
Okay.
great cleaners. They clean excellent. They're environmentally sensitive, easy. They break down into hydrogen and water. And when you get one like the Optum One, it has a 1 minute contact time. So you can
Okay.
imagine with it being water-based, it's going to stay wet for
Yeah.
that 1 minute to kill the microorganisms. So it's important to know whichever disinfectant you use
Mhm.
that you know what the wet contact time and is it a cleaner and are that everybody's using it properly. Now the training session that I did yesterday
Mhm.
for a California orthodontic office, the question came up, well, Jackie, what about spray? And if you have something that's difficult nooks and crannies, like an alternate impression, yes,
Mhm.
you might want to spray that, but it really is safer for the team to
Mhm.
use wipes than it is to spray.
Mhm.
You
Okay.
can imagine if you're spraying, then there's the potential of breathing in that aerosolized disinfectant.
Okay.
So wiping helps us to clean and leave the surface wet with the disinfectants. Yeah.
No. Okay. One more thing I wanted to ask you before we're done is you've been talking to a lot of practices who have opened in the last couple weeks.
Yeah.
What has been the feedback from staff? Are they feeling comfortable?
Yeah, I've been doing a lot of Zoom meetings. We're on the Zoom meetings from anywhere from an hour to 2 hours.
Mhm.
Yesterday it was even 2.5 hours because they had some questions And they
Yeah.
were making changes. They were, during this downtime, they're changing from dry heat sterilization to steam sterilization. So I
Mm,
wanted to be certain that the team understood what they needed to be doing. But I
okay.
am getting a lot of feedback from the offices. And I had a wonderful call, again, from an office that I've worked with for over 20 years.
Mhm.
Dr. Don Spiller's office. I think you've interviewed them in the
Yeah.
past and even done an article about the technology that they've implemented it. And Eden called me from their office. They were looking at putting on an appreciation seminar for their referring dentists this fall. And while Eden and I were talking on the phone, I said, Eden, how long have you been open? And they're in Georgia. So
Mhm.
they were one of the first states to reopen. So they've been seeing patients now for almost 2 weeks.
Mhm.
And she said, it's going great. I
Oh,
said,
that's good.
oh, so glad to hear that. She said, you know, Dr. Spillers, he investigated everything for safety measures and what we needed to change and all of
Mhm.
that, the PPE for the aerosols and the airborne precautions with it. And we did a review of our training with the team. And they have 2 offices and a really big team. They have almost 30 staff members.
Oh, okay.
And she said, Jackie, I felt really safe coming back. And, you know, my husband is medically compromised.
Mhm.
And she said, even with him being medically compromised, I certainly don't want to take any germs home
Right.
that might come into the ortho office. And I feel so confident and safe of what we're doing here
Mhm.
that it was a joy to come back into the office and know that I'm not carrying those germs home. So I think all of the training that we've been doing, that
Mhm.
practices where you have that leadership from the doctor and from the practice administrator and the infection preventionist, and we've communicated accurate information and
Mhm.
updated it as more data and
Yeah.
medical information has come available from CDC. That's reassuring the teams that yes, we're doing everything we can to resume caring for our orthodontic patients in a
Mhm.
safe environment for the patients and for the staff.
Yeah.
Yeah.
That's definitely important now. Well, I think this is great information for our viewers. Jackie, thank you again for being with me this week.
Excellent. You lead us through, Allison, in a great way. Thank you for all of the questions because you identify where the needs really are. And it's a good information sharing time. So I look forward to our next episode of In the Sterilization Room.
I
Thank
do
you.
too. Yes. Well, we will be back next week for our next episode. And if you would like to view previous episodes, check out the playlist on YouTube that we have on our channel. And for the latest orthodontic industry news, please visit orthodonticproductsonline.com. We are here to help you get back to work. So until next time, take care and stay safe.